Let's test your pharmacology knowledge. I'm going to give you the generic name of the medication with the prefix or suffix, and I want you to identify the subclass. So I'm going to group this up into categories. So the focus of this video will cover antibiotics. As I am going to go through the questions, please feel free to pause if you need to do so to decide on your answer. Shortly after, I will provide you with the answer and a quick review. Beginning with doxycycline. Prefix or suffix is cyclin. Which subclass category does this medication belong to? Is it A, cephalosporins, B, penicillin, C, sulfonamides, or D, tetracyclines? The answer is D, tetracyclines. This medication is commonly used for acne, community-acquired pneumonia, or sinus infections, to list a few. Make sure to monitor your patient's BUN or creatinine and liver function tests for prolonged use. Some common side effects: it can cause permanent tooth discoloration in your child that's less than 8 years of age and reversible for the adult population. It can also cause some GI discomfort such as nausea, vomiting, diarrhea, and some hepatotoxicity. If you appreciate the content, be sure to give this video a big thumbs up. Okay, moving on to the next medication, cefazolin or cephalexin. Prefix or suffix is ceph, C-E-F, or C-E-P-H. Which subclass category does this medication belong to? Is it A, aminoglycosides, B, penicillin, C, cephalosporin, or D, fluoroquinolones? The answer is C, cephalosporins. So it can be used for skin infections, bacterial infections, or uncomplicated urinary tract infections, or streptococcal pharyngitis. Some common side effects: it can cause nausea, vomiting, diarrhea, headaches, lethargy, and superinfections if you do not complete the medication as prescribed. Moving on to the next medication, ciprofloxacin. The prefix or suffix is floxacin. Which subclass category does this medication belong to? Is it A, penicillins, B, fluoroquinolones, C, sulfonamides, or D, antiviral? The answer is B, fluoroquinolones. Please see the list for the most commonly prescribed fluoroquinolones. These medications are commonly used for urinary tract infection, uncomplicated pyelonephritis, pneumonia, prostatitis, or bacterial infections. Some side effects can include abdominal discomfort, headache, dizziness, a prolonged QT interval, tendon rupture. Make sure to monitor the patient that comes in complaining of Achilles pain. Just ask them, hey, have you been on a fluoroquinolone within the last 3 months? And they'll be able to answer that question for you. Moving on to the next one, acyclovir or oseltamivir. Prefix or suffix is cyclovir or VIR. Which subclass category does this medication belong to? Is it A, sulfonamides, B, aminoglycosides, C, antiviral, or D, antiretrovirals, also known as protease inhibitors? The answer is C, antivirals. So a common use for acyclovir is used for herpes, and common use of oseltamivir is for seasonal influenza. Both of these antiviral medications, you want to monitor kidney function at baseline, which includes your BUN or creatinine, and monitor for long-term use. Some common side effects include nausea, emesis, diarrhea, or headache. If you find this content valuable, please feel free to share and comment below. All right, back to the video. Okay, moving on to the next medication, amoxicillin. Prefix or suffix is cillin. Which subclass category does this medication belong to? Is it A, macrolides, B, tetracycline, C, sulfonamide, or D, penicillin? The answer is D, penicillin. Common use for penicillin is for treatment of streptococcal pharyngitis, also known as strep throat. Can also treat sinus and ear infections, pneumonia, bacterial infections, or H. pylori infection. Some common side effects can cause GI upset like nausea, vomiting, diarrhea, and a sore tongue. So educate your patient to complete the full course of the prescribed medication because it can cause a super infection. Moving on to the next medication, sulfamethazole or trimethoprim, also known as Bactrim. The prefix or suffix is sulf. Which subclass category does this medication belong to? Is it A, antiretrovirals, B, aminoglycosides, C, sulfonamide, or D, antifungal? The answer is C, sulfonamide. This medicine is commonly used for mild to moderate bacterial infections, most commonly used for like a UTI. So if your patient's urine culture sensitivity report comes back, this is the most susceptible for treatment choice for a UTI for E. coli strain. Some common side effects includes GI upset, headache, dizziness, nephrotoxicity, hepatotoxicity, and caution with your dialysis or renal failure patient because it can cause hyperkalemia. An alternative could be like Vantin, which is a beta-lactam or cephalosporin based type of medication. Moving on to the next medication. Ziduvudine, prefix or suffix is vudine. Which subclass category does this medication belong to? Is it A, antiretrovirals, B, nucleoside reverse transcriptase inhibitors, or C, antifungal, or D, aminoglycosides? The answer is B, nucleoside reverse transcriptase inhibitors. The use of this medication is prescribed to patients with HIV or AIDS. Some common side effects, it can cause headache, fatigue, insomnia, elevated liver enzymes, rash, or abdominal pain. As a black box warning for patients with advanced HIV, it can cause severe anemia or neutropenia. So it's important to monitor the patient's CBC with DIF at baseline and every 2 to 4 weeks post initial treatment, then every 3 to 4 months with a glucose and liver enzyme check. Moving on to the next one. Fluconazole. Prefix or suffix is azole. Which subclass category does this medication belong to? Is it A, antifungals, B, antiretroviral protease inhibitors, C, aminoglycosides, or D, selective serotonin reuptake inhibitors? The answer is A, commonly used to help treat yeast infections, also known as candidiasis, affecting the vulvovaginal, esophageal, or systemic. Some common side effects can cause dyspepsia, nausea, abdominal pain, or elevated liver enzymes. As a nurse, you want to monitor your patient for signs of hearing loss or peripheral neuritis. All right, here's your bonus question as we are moving on to the last one. I'll give you the question, you provide me with the answer, as there are 2 categories to this medication option: gentamicin and azithromycin. The prefix or suffix for gentamicin is mycin, M-I-C-I-N, and prefix or suffix for azithromycin is mycin, M-Y-C-I-N. Which subclass category do both of these medications belong to? Gentamicin is listed as a aminoglycoside and azithromycin is listed as a macrolide. Aminoglycosides includes gentamicin, neomycin, streptomycin, or tobramycin. Some common side effects for aminoglycosides includes ototoxicity, confusion, palpitations, blood pressure changes, or renal toxicity. Some medications that fall under macrolides includes azithromycin, erythromycin, or clarithromycin. Some common side effects with the use of macrolides are GI effects, confusion, and super infections. If you appreciate the content, consider subscribing, and I'll catch you on the next one. Take care.